Dr. Malik, tell us a little bit now about how technology has gotten involved recently and specifically on using image-guided, computerized navigational assistance to gain minimal access for the surgery.
So over the last few years, I would say maybe 8 or 10 years, technology has revolutionized how we operate. About 10 years ago, and me and Dr. Ansel, we were talking just before the seminar started, the usual way of doing a craniotomy, I mean, myself, I'm a neurosurgeon, would be to do an MRI, and an MRI would tell you where the general location of a tumor or a mass is, and beyond that, you were practically on your own, because head is a sphere, and to get into it, all you had was an MRI that you could look at and say, okay, I think the tumor is going to be in this area. So our incisions in the brain used to be fairly big. The scalp incision, we had to shave the entire head to get in there. When the stealth navigation system came out, initially, there was a big learning curve. So we call it a steep learning curve. It took us a long time to learn it, to really understand it, become comfortable with it. And eventually, when we learned it and became comfortable, we realized that an incision which used to be yay big, all of a sudden started being yay big, because that's about all the exposure you needed to get to where you needed to be. So keeping that in mind, we have now certain tools in the spine. And one of them we are going to talk about today is a robotic system which is sitting in front of you, which essentially, if you would think of it as a GPS of the spine. So a GPS is as good as the person operating the GPS, right? Everybody's used a GPS. So if you're able to input good information in there, it'll give you very good data, and it'll lead you exactly from point A to point B. This is exactly what it does. It allows you now to gather information prior to surgery, do a CAT scan, and then load all of that into a computer, and at time of surgery, it spits out information as close to perfect as a human can be, within a millimeter or millimeter and a half, which I think is fairly precise. And so it's really helped us in pinpointing and placing our incisions and doing surgery now that we have this.